Good afternoon to everybody, and also good morning from whoever is joining us from other parts of the world to this Euro-Mediterranean Economists Association webinar, which is dealing with fueling and funding equitable mental health innovations, a pillar for building brain capital. So this webinar is organized under the Brain Capital Alliance, in which Euro-Mediterranean Economists Association with other colleagues are promoting. And I think this is a great opportunity also to share with you that our activity on the brain capital has been launched at the UN General Assembly 78 in New York a couple of weeks ago. So we're very happy to host this webinar, also in collaboration with the Rice University Baker's Institute for Public Policy. And I would like to thank very much Harris Ayer, who has been very much involved in the organization, and hopefully we can see him soon in Barcelona. So let me start with the introduction for those who they are not familiar with the concept of brain capital. So brain capital is a new concept that incorporates brain health and brain skills. In collaboration with our colleagues from the Brain Capital Alliance, led by Harris Ayer, we developed a very interesting dashboard, which in fact allows to understand the brain health and brain skills globally within a global concept. And this allows us also to understand and to measure and to monitor the brain capital. So in fact, our idea here of brain capital is a productive and complex capital stock that accumulates over the lifespan of people. And we consider, in fact, this brain capital as a key determinant for our economic systems. And in fact, it's a multidimensional set of factors that need to interconnect with each other. And these factors could be socioeconomic, they could be health-related, physical-related, and also enabling, in fact, the brain to remain healthy, to develop and to prosper and to flourish, and also what is very important in the lifespan to avoid deterioration over time. So, in fact, brain capital becomes an element, a proactive element by every individual that could act upon and ensure that this brain capital stock at an individual level, but also at a country level, remains really at its highest and does not deteriorate. Now, mental health, in fact, it's key component of the brain capital. Given mental health disorders is costing trillions of dollars per year to the global economy, for example, lost opportunities for productivity, for example, and also disorders such as anxiety, depression, bipolar, and schizophrenia also impact individuals, families, and communities. And this has not only financial costs, but also social and emotional costs to the community at large. So, in fact, action needs to be put in place at a global level to ensure that this is really dealt with from a global policy perspective, but also from a regional and local perspective. So another aspect that we would like to dig into this webinar is the issue of equity. So equity in mental health, in fact, refers to ensuring that everybody has fair and just opportunity to attain their highest level of mental well-being. So in fact, it's really related to the open access to everyone to the same healthcare and mental health, but also at the same time to eliminate as much as possible the barriers such as, for example, discrimination, stigma, lack of access to care at all lifespan of the individual, but also those who are under under socioeconomic disadvantages. In essence, it's really about addressing the inequality in terms of mental health, experiences and care, and outcomes in all different populations. So, and this is important also to ensure that equity is really dealt with from a policy perspective. And this is all allowing the possibility to everybody to have access, to have also affordability of this mental health access and so on. And this does not come without, for example, innovating in this space and ensuring that innovation is also accessible to all the population, not only to a segment of the population. And what to do with it? I mean, how to ensure that equity is prioritized in terms of mental health innovation. And in fact, all the population, including the vulnerable and marginalized ones, have access to care and support they need over their life span. And this is all important. They need over their life to ensure that we are in a situation where we ensure a fair access and also well-being to all. So with this introduction, I would like to introduce this webinar. So this webinar is part of the series of webinars that the Euro-Mediterranean Economists Association has been doing now since the COVID time. And we continue to also allow as much access to people to really listen and to connect with the expert or international expert that we invited today. The whole idea is really today is to delve into the concept of equity in terms of mental health in connection to the brain capital building that we are trying to develop together with our colleagues from different disciplines, economists, and also neuroscientists, psychiatrists, and psychologists, and in different parts of the world. And this is very, in fact, essential to provide a transformational thinking for our economies to, in fact, address the societal challenges that our populations nowadays are facing, not only in terms of the mounting violence, but also in terms of the consequences of the pandemic and all the social and economic hardships that many people are experiencing nowadays. So let me first of all, to start with, ask my colleagues to show the video from Harris Ayer, who has prepared this for us just for a few minutes to give the overall thinking about this framework and to allow us, in fact, to better understand this global, or I'll call it new thinking, new economic thinking that we are trying to put in place. And then we can follow up with the other high-level speakers that we have today. So please, you could post the video in the next few minutes.
Good day, everybody. If I'm not here with you live, I'm probably in the delivery room with my wife, welcoming our first child into the world. Today, I'd like to give you an overview of brain capital. Many of you will have heard of brain capital before, but I'd like to give you some late-breaking updates on what we've been up to. So we're very excited at the moment with the Brain Capital Alliance. About 3 weeks ago, we held a wonderful event at the United Nations General Assembly in New York. We welcomed the governor of Washington State, Jay Inslee, and the Secretary of Health for California, and we had an entire day talking about brain capital building, looking at brain capital policy innovations across all policy areas, from health policy through social, built environment, environmental, et cetera, et cetera. And so we've just released a report on this. If anyone's interested, I'd be glad to share it with you. And there was also a wonderful Lancet Neurology paper written about one of the days as well. So brain capital is this construct that puts a premium on brain health and brain skills. Brain capital, we believe, needs to be seen of as important when you run a country as GDP and as road and bridge infrastructure. Brain health, obviously, you all know what that is. It's a lifespan concept, looking at not just the deficits of the brain, but also the strengths of the brain. And brain health is important for the prevention of disorders, mental and neurological disorders. It's also important for, optimizing someone's life when they have an actual disorder as well. And brain skills are skills like creativity, adaptability, resilience, the skills that are critical to our abilities to navigate the modern world and the future world that's pending. So our brain capital is under siege. We know that, of course, the economic costs of these issues are massive. Trillions of dollars are lost every year to the economy. The challenges are on the left there: chronic stress, COVID-19, social isolation, disinformation, etc. And this all results in mental health challenges, neurological challenges, educational disruption, and workforce issues as well, labor market issues. So it's important in brain capital, as I said before, that we go beyond just thinking about issues related to health and health policy. We need to think about, for example, education. And when you look at these statistics in youth mental health, they're really dire. Arguably, this is the age group that's faring worst, with its mental health. So that means we need to think about providing new solutions into schools and universities as well. It's important, of course, if we're proposing that brain capital should be a big new economic asset and a big new approach to the way that we govern nations and states, that we can actually measure it. And so fortunately, we published a paper a couple of weeks ago through the Brookings Institution on our global brain capital dashboard. And here you could see on the right the dashboard and what it looks like. It's available through the EMEA website. Thanks very much to Rim for her leadership and to the wonderful working group that's worked on this. You can see down the bottom, we've been looking at drivers of brain capital, social determinants of health, economic determinants, digital determinants, environmental determinants. We're looking at brain health metrics in the middle and brain skill metrics on the right. We believe that there is a brain capital gap in society. There are the haves of brain capital and the have-nots. The haves, like frankly, all of you in the room today and online, are probably in the haves portion. Folks like us are going to keep doing better and better in the world as it gets more, cognitively intense and jobs get more, complicated. We'll be able to keep up. We'll be able to co-pilot with AI, etc. But folks that don't have the requisite brain skills and brain health, folks that are living with mental health challenges, folks that are living with lower educational attainment and lower socioeconomic status, they're going to struggle, right? Their jobs are increasingly at risk of being automated away or offshored. If people lose their jobs like this, they lose purpose. They get much more likely to have depression, anxiety, and if you get depression, anxiety, you're much more less likely to have the energy to get upskilled and reskilled. So we really need to tackle this equity issue and this inequality issue, because it's only going to get worse. That's why we need to think broadly across all policies for innovation, and we also need to think about new investment approaches. So fundamentally, we think that equitable mental health innovation is a key to unlocking brain capital around the world. This is obviously the theme of this webinar today and this event there in Barcelona. Wonderful to see that Shekhar Saxena, who previously ran the World Health Organization's Mental Health and Substance Misuse Department, he says that when it comes to mental health, all countries are developing countries. So that's true for outcomes with mental health across the world, a lack of clinicians across the world. So this is not just an issue for the global south, this is also an issue for the global north. And I'm glad that you'll be hearing today from folks like Steve from California and Tina from Denmark, who will be talking about their perspectives in the global north. So digital equity is critical. We need to think about new solutions. I'm sure all of our speakers today will be talking about this, new solutions, digital access infrastructure is key, like broadband, particularly in the global south and in very remote parts of the world. Digital health literacy is important. If we want patients to start using tools, for example, they need to be literate and know how to navigate, digital systems. And then, of course, workforce competency is critical as well. Most of these tools will be provided via clinicians, whether they're doctors or allied health or nursing or whatever. And so we have to make sure that the workforce is ready. So this obviously then is important for the workforce to be not just culturally competent, but digitally competent. So thank you very much. And I look forward to hearing everyone's thoughts about this event today. Thanks.
Thank you very much, Harris. I know that you are hearing us on the ground. I hope everything goes well for today and tomorrow. I think you have set the scene, and this is what we would like to achieve. And I absolutely agree that equity is a key aspect that we need to focus on. It's a priority for building the brain capital framework and all what comes out with it. And you also mentioned the post-industrial strategy that is built on brain capital and should be taking into account the concept of equity at all levels, but not only, in my view, at the mental health innovations, but also in terms of the skills and access to education. Still, some countries, they don't have the equitable, I would say, access to quality skilling and upskilling and education. And this has to, in fact, be as important as, in fact, accessing innovation in the mental health space. So thank you very much for providing us this overall view. And I want to remind that Harris Iyer, he is the co-founder of the Brain Capital Alliance. He's also a fellow at the Baker Institute, senior fellow at the Meadows Mental Health Policy Institute, and member of the advisory board of the Euro-Mediterranean Economists Association. And he has been really leading this framework of brain capital. He's a neuroscientist and a global physician executive. And I think this interconnection between neuroscience and economics and finance is essential to ensure that the capital is really driven where it should be, and it really serves the people at all levels in terms of their health, but also in terms of their education and skills. So thank you again. And I also like to emphasize the fact that this neuroscience-inspired policy initiative has been pushed forward by the OECD, by our colleagues back then, and it will continue with all the members of Alliance, including Shekar that you mentioned. So thank you very much, Harris, to introduce the concept. So I would like to move without further ado to Steve Carnevale, who is the California Mental Health Commissioner. So I'm very happy to welcome Steve in Barcelona. He's in Barcelona, in the other part, or in the other room of EMEA. So Steve, he is a very successful entrepreneur. He founded many businesses, including the University of Michigan Center of Entrepreneurship. So when we discussed yesterday, we saw how many aspects that we share in terms of the entrepreneurship, in terms of mental health, and also he's the founder of the UCSF Dyslexia Center and also Point Cypress Venture. He is the commissioner of California Mental Health Commission, and I think this momentum is so important because when we were in New York, we thought that this brain capital could offer a great framework to build something new, to build something transformational, and to address the challenges that our economies they are facing and our people are facing nowadays in terms of the mental health and all the difficulties our societies are going through. So please, Steve, the floor and the screen is yours.
Thank you, Rem, and thank you for being such an incredible host here in Barcelona. I'm sitting in the EMEA offices, which are extraordinary in and of themselves, sitting on an extraordinary campus here, and very excited to be talking about ways to consider partnerships between California and Barcelona and broadening that between the United States and Europe and beyond. So very exciting conversations. Equity is such an important issue, and I'm really glad that you've dedicated this webinar to that. I was a couple of weeks ago as part of a commission tour. We spent an entire day in a place in Los Angeles called Skid Row, which is pretty famous for having, a very unfortunate population of those who struggle the most in society. And what became so apparent is that the system is just stacked against them in so many ways. And equity was part of our unfortunate partnership throughout that day. But I'm getting ahead of myself. I think equity cuts a couple of different ways. One is that there is not even equity between mental health and healthcare. It may shock some of you to know that the mental health system's actually separate from healthcare, and that somehow early on, I guess historically, this became the case that we thought of behavioral health issues as being separate from general health. And we know both from now our knowledge of general health as well as our deepening understanding of brain science that they're inextricably connected to each other. And so having them as separate systems in and of itself creates a lot of equity issues. If you think about physical health issues, whether it's related to the heart or cancer or any other general health issue, we do not treat them. We treat those issues with much more urgency than we tend to treat the mental health issues. And that's why we're seeing the pandemic of mental health continue to grow out of control, seemingly without the ability to contain it. On a more specific level, there is this huge equity gap between the public and the private sector. So backing up, and that's what I want to talk about next, I'm a governor appointee to the California Mental Health Commission. Governor Gavin Newsom appointed me, and the commission and myself personally have been working closely with him and with Secretary Ghali, who runs Health and Human Services. And it's a massive organization in California. Over $12 billion a year alone are dedicated to mental health. And it's not nearly enough to address all of the issues we have, because we tend to put too many dollars into an already failed system and not enough money into earlier prevention and early intervention. But in addition to that, one of the real big opportunities around equity is that there's a lot of private money that gets invested in advanced technologies that make their way into the private sector and the insured populations, but the people that need it the most in the public sector will not see those innovations for sometimes 10 or 15 or 20 years. And in the governor's own words, he just said, this is deplorable that we've got this equity gap, and it shouldn't be that way. And so he's tasked the commission under the framework of brain capital to do something to close that gap. So we are working hard to consider ways to bring the public and private sector together. And I believe that is one, the problems are complex, so the solutions are not simple. This is only one, but this is an important solution to the problem. We have to get the public and private sector working together. The private sector has money, and it has focus, and it has the ability to bring technology to the problem. But the public sector is the sector that owns the problem and has the sensibilities around helping those people that need it most. And in partnering together, we think that we can make a lot more progress, and we intend to make more progress in California. I know later today you're going to hear from someone connected to a Danish public-private partnership that I learned about recently, and we're now in conversations between the governor's office and Denmark to talk about ways that we can learn from each other and work together in that regard. this is a unique opportunity from my perspective. I sit in a unique spot. I'm a business person by background. I've done venture capital for a long time, and I came into the public sector more recently. I came into it because I have a son who got diagnosed at a young age being a dyslexic learner, and that led me to eventually starting the Dyslexia Center at University of California, San Francisco, which has is a partnership between psychiatry and neurology. In psychiatry, we have amazing community outreach programs that we'll also hear about more later from Marina, and neurology, where we have the leading neurology department in the country and a lot of the cutting edge research. We are in the golden age of neuroscience, and our ability to understand the brain is just at an advanced level that we couldn't have imagined 5 or 10 years ago. And we know a lot of the problems that we only were guessing about, we are now able to understand with more precision. And I've seen this applied. UCSF has applied that precision neuroscience to the Memory and Aging Center for aging diseases. We've been applying it to the Dyslexia Center for precision medicine in precision education with all our children who are different learners. And now we're looking at applying that into the mental health system. And that promises to change everything. So that's what leaves me very optimistic, because when we understand a lot more about the brain, it will literally impact everything that we think about and everything that we do, and it will give us much greater opportunity to address the problem. So it's one of the reasons that I volunteer so many hours to look for these kinds of solutions. As Rim mentioned, I'm very involved in entrepreneurship. It's my other great love, and I think entrepreneurship itself is a key to this, not only because entrepreneurial ventures can provide those new cutting edge solutions, whether they're more pharmacological or they're more related to digital solutions and other solutions that are non-invasive that can really tap into the brain in ways that we haven't thought about before. But the other way entrepreneurship emerges is I'm very involved in a program in Oakland, California called ESO Ventures, which actually trains minoritized populations, Black and brown, underserved populations who desperately want to be entrepreneurs. In their own words, they want to own their own city, but they don't have any of the connections or the skills or the resources to do that. And ESO Ventures has proven over the last few years with funding from the state of California that we can train entrepreneurs to be successful. It's what I call entrepreneurship therapy, because it not only provides economic outcomes that are much improved, brings people into a middle class, which in and of itself, again, is equities related to mental health issues, but it's very preventative by treating people with respect and and giving them purpose in life. These people who would otherwise inevitably end up in our mental health system getting more services instead become net positive contributors to society, and they help other people peer to peer. So there's a lot of opportunity with entrepreneurship to close this equity gap. So I guess I'll close it there and just say that the California, our governor, Gavin Newsom, is leading an effort in mental health. We have an entire modernization mental health program going forward that includes the reorganization of a lot of our mental health services, and it includes delivering a lot more services to address the homeless issue, which I've learned is more critical in California because we have it's very simple. We have the most expensive housing. And so people economically fall out of the system faster and in larger numbers. But that housing is not the only key to that. You've got to create wraparound services that allow those people to get the mental health treatments they need and to get the job assistance they need to get back into a become a positive contributing member of society. And the governor is leading an effort to improve all of those programs and working with our commission to make that happen. So I look forward to learning from the rest of the world in terms of what they do well in mental health, but also being very proud of what we are trying to do in California to make improvements. Thank you very much.
Thank you very much, Steve, for this overview and bringing the experience from California, not only to the Mediterranean here in Barcelona in Spain, but also for other countries in the Mediterranean and Africa. And I think we need it badly. In our dashboard, we see clearly that we are lacking a lot of data in these countries. We need more data to better inform the situation of mental health and brain health and brain skills. And this also allows us to better understand from a neuroscience perspective brains and how the brains they operate and how they really transmit the outcomes to the societies and to the economy. And I think we are still far from really optimal knowledge in that sense. We are still, in reality, believing that the brain is functioning optimally, but it's not at all the case. And I like very much what you're saying about the entrepreneurship therapy. Entrepreneurship skills are skills in our brains because it's really connecting risk-taking, management aspects, resilience, diving into uncertainty, and all of these are all skills of an entrepreneur, not only to create value, financial value, but also to have a purpose in what they do. And it's so interesting to also discover your project in California, which goes hand in hand with what we're doing here in Barcelona for the South Mediterranean countries in entrepreneurship in cultural creative industries. Of course, the whole concept is similar, but we need to continue with this, I would say, innovative experiences and learn from each other. So thank you very much for being with us today, and we will continue on this construction. So I would like to welcome Tina Hochland. She's the Senior Director of the Lundbeck. Lundbeck is a global pharmaceutical company specialized in brain diseases. We've been connected also in New York a couple of weeks ago. And Tina, you heard from Harris. I think we discussed this concept of brain capital. I'd like to hear from you. How do you see all of this? Being the head of global public affairs of Lundbeck in terms of these brain health and brain diseases, and how do you see the trends and you see the opportunities, please?
So thank you, Rim, and thank you to Harris online as well for giving the opportunity to speak here today. I'm honored to be asked or invited to speak in the context of fueling and funding equitable mental health innovation. And I think what I will present to you today, I believe, is very much an example of how a society practically can fuel and fund equitable mental health innovation. About me, as you said, Rim, I'm head of global public affairs at Lundbeck. Lundbeck is a global company with headquarters in Copenhagen. We're operating in 50 countries around the world, and we are represented in the what we call in pharma the entire value chain. So from early research to development, of course, production and commercialization around the world. We are focusing on brain health, as you say. So this is what we do, and we see brain health covered by mental health and neurology. So that's our business. I wanted to share my screen with you because I have a few slides that I wanted us to look at, if I can make it work. So I've called my presentation today for the power of public-private partnerships. I just wonder if you can see my screen. Yes, should be visible now, right? I've called it the power of public-private partnership. because this is what the lighthouse is, and this is what I'm going to speak to you about today. The Lighthouse Life Science is a public-private partnership that aims to ensure better health and more equality in health, while at the same time strengthening growth. It's an initiative that was made by the Ministry of Industry right after COVID, so it's a couple of years ago, where the ministry, the government wanted to make sure that growth was getting back to especially small to medium-sized companies. And therefore, it was established as a partnership between companies, between startups, between funds, pension companies, regions, and municipalities across the capital, but also across the Danish country. It will run until 2030. It has gotten a lot of public funding, but it also relies on additional private funding. And it's facilitated by what we call the Danish Life Science Cluster, a kind of a secretariat, experts in setting up strategic partnerships and pilot projects. The wish is to have this public-private partnership being led by a big Danish company into life science. So for the first couple of years, Novo Nordisk, another Danish pharma company, led the initiative, and we've just taken over Lundbeck now a couple of months ago. So if you look into what we're really doing, the vision is to create innovation, and this is the key, the create innovation that helps improve health, but also strengthen the growth. So it has these two legs, while at the same time positioning Denmark as an international lighthouse within life science. We do this through a model with a number of different efforts. So we support national strategies and political priorities by solving what we call real health challenges. And we do this through prevention, identification, and treatment of chronic diseases. We develop and implement solutions in collaboration with the people it really is all about. So the patients, the citizens, employees, and companies to improve their health. We build on evidence. We measure everything we do, systematic gathering of data and value creation. We develop competences with the partners we work with. And we do this while at the same time creating growth and export for the small to medium-sized companies we're working with in the partnership. The first phase of the lighthouse, the first 2 years, focused on healthy weight, and that was being led by Novo Nordisk. As you might know, they are specialized within diabetes and weight. And the report they could bring forward already, like now 8-9 months ago, so back early this year, is quite impressive if you think of Denmark being a small country and this being developed over the first year and a half from what they've this is what they have achieved. What I wanted to make more focus on today is, of course, the second phase, focusing on mental health. And as I said, we only took lead from Lundbeck's side on this a couple of months ago. There's a huge burden on mental health disorders in Denmark, as there is across the world. And this whole burning platform of not having resources, not having hands and feet enough in the sector is a driver. Is a burning platform is a driver for what we are doing. There's a lot of inequality within this area. We've spoken to that already. People with mental health disorder live shorter lives, they receive less education, and they are often outside the labor market. So there's a lot to do here. But in Denmark, there's a political willingness to actually invest in this area right now. And with a broad political support and also investment in this area, we're linking to that with the Lighthouse. That has concretely materialized into a 10-year psychiatry agreed with the Danish government and politicians here. And that is what is being emphasized in the work we're doing. And then we build on the Danish stronghold of life science. Denmark has a strong life science environment with both large and small players, and that is important to the whole initiative here. We, as I said, is supporting national strategies and political priorities. We help solve real challenges. And the 10-year psychiatry plan I spoke about before has kind of identified out of 38 things that they see as relevant and highly needed. They say the 5 most important ones are the ones I've highlighted here. So children and young people, people with severe mental disorders. The whole stigma around mental disorders is important to address. And then the research, prevention, treatment is important to address as well. Our achievements so far, we have more than 300 partners up until now, after only a little more than 2 years. And we've already seen international interest in looking into the lighthouse, seeing if this is a concept that could be used elsewhere. And we are more than happy to inspire on this. We are focusing on prevention, we are focusing on identification, and we are also focusing on treatment, on how we can build even further on this. And my last thought would be on, so why does a company like Lundbeck spend time on this, and why do we focus on this? So one thing is that we have been in the space of mental health for more than 70 years. We are more than 100 years old, but for more than 70 years, we have focused on developing innovative medication within mental health. But we are more than that, because we are part of a Danish society, a Danish life science nation, where there's a lot of focus on wealth and health. There's a strong link between primary and secondary sector. There's a strong focus on prevention and early detection, on elderly care, and so on and so forth. And even further to that, we feel that we have a responsibility to also show the society we are part of, to also bring forward solutions that can help the whole mental health situation in our country to develop, and to help those who are in need of help. So this wraps my little presentation. Happy to take questions later when we have Q&A.
Thank you, Tina. Very comprehensive presentation. I have a few questions that I reserve to later on. But this is a great initiative. I congratulate you for it. I think private-public partnership nowadays is essential to deal with all these global societal challenges we have. Looking as an economist, there is no way that the private sector only or the public sector only can work alone. They have to work and find ways to connect and then deal with the long-term challenges and the short-term challenges at the same time, while calibrating their expectations in terms of value creation and value sharing. So I believe very much in burden sharing from the short run to the long run. And I think this is also what made, in a way, the European Union burden sharing, although step-by-step approach, but at the end, to deal with global societal challenges, like, for example, the climate change or the increasing diseases and all of this, or mental health, we really need to have these private-public partnerships, and we need to know how to structure them and design the appropriate incentive structure. And I think this is what needs. So thank you very much for sharing this presentation, this experience with us. So now I would like to welcome Dr. Fadi Malouf. Fadi, he is coming from American University of Beirut. He's a professor and chair of psychiatry. Thank you very much for joining this webinar, and also I'm looking forward to meet you face-to-face in Beirut if the geopolitical situation allows it, because now we are we are seeing what is happening in that part of the world, and we are looking at it with a huge concern. But Malouf Fadi, he is very much interested in the areas of epidemiology, of childhood psychiatric disorders, and particularly on emotional disorders, and also in school-based youth mental health interventions that aim at bridging the treatment gap of this population. So really, that space is also essential in the construction of the brain capital, and we're also very much happy to collaborate to develop something together for our region. So Fedi, the screen is yours.
Oh, thank you, Professor Ayadi. It's a pleasure to be with you this afternoon. I want to thank you and thank Dr. Harris as well for the invitation. I've enjoyed listening to colleagues. It's I'm presenting this at a time where the Middle East area is going through, as you mentioned, unfortunate re-eruption of violent events. So I'm very sorry for the lives that are being lost, and I hope this will end soon. I will be talking about equitable mental health in the Middle East. I'm a child psychiatrist myself, clinically, and a researcher in child mental health. But as you mentioned, I oversee the operations of the Department of Psychiatry here at the American University of Beirut. And what you're seeing behind me is actually the picture of the campus of the American University of Beirut overlooking the Mediterranean Sea. I'll share some facts about the Middle East, talk about the resources and utilization of mental health resources, and talk a little about research and innovation. This is the Middle East. It's the definition, actually, it's interesting. There are 18 countries that share common factors, and these common factors can be ethnic, geographic features, religious, and political history. But if you look closely at the different countries, although they have many things in common, they also there is heterogeneity, specifically in terms of income and size of population. But in general, they're mostly low to middle income countries. They're mostly Arabic speaking. They contribute around 10% of the global population. The majority are below the age of 25. So our population is a young population. Unfortunately, more than a quarter live below the poverty line of $1.9 per day. And we're known as being the origin of 64% of refugees around the world, and close to half of the population living in this part of the world is in need of a humanitarian assistance. So this is just to put things in context. Before we talk about mental health, it's important to talk about basic needs and basic health as well. So this is an area that is known to be exposed to ongoing conflict, and its population is also exposed to what we call toxic stress. And this is more of a biological or biopsychosocial slide, but this is showing you at the left part of the slide how early on, the brain of animals who are exposed to toxic persistent stress, the brain architecture does change. And there are fewer synapses that are being formed, which may impact the development of these animals later on. In humans, and using income to need as a proxy to toxic stress and ongoing stress, you see that children who are exposed to this type of toxic stress have smaller brain volumes. We're talking about brain capital today. They have smaller brain volumes, and if we use Lebanon, for example, as an example, and this is the rightmost part of the slide, we conducted a study looking at cognitive performance and IQ of the Lebanese population, and there was really a very close correlation between education, income, and mental health and IQ and cognitive functioning. So kids who came from lower income families, kids who had mental health problems, behavior problems, performed poorer on these cognitive measures. So the resources and utilization. This is taken from the most recent WHO Atlas, and EMR refers to the Eastern Mediterranean region, looking at inpatient resources, mental health resources per 100,000 individuals. You see that in the EMR, we're at 002. It's 50% of the global rate. If you look at psychiatric units in general hospital, in the EMR, we're at 005, which is probably 0.17 is great. If you look at outpatient facilities and outpatient services, for example, here we're at 0.1 compared to the global rate, which is at 0.26. This is just to highlight that although, as it was mentioned by Harris earlier, when it comes to mental health, all countries are developing countries, quoting Dr. Saxena, you could see that the Eastern Mediterranean area is still lagging behind compared to global data and global availability of resources. You see as well here that governments spend a smaller amount of funding on mental health. So only 2% of the health the health budget in general, on average in this part of the world, is dedicated to mental health. Compared to, I was glad to listen to Steve about the resources in California. So we're much slower than that in terms of budget allocation to mental health. And in terms of as taking schizophrenia and psychosis as a specific condition, you'll see that compared to, for example, 76% of individuals with the schizophrenia in Europe are receiving coverage for this condition. We are at 19%, and globally it's 30%. If we take Lebanon as an example, and this is my area of research, we have a treatment gap of 94%. So 94% of our children and adolescents and youth who are in need of mental health assistance, who were diagnosed with a mental health problem, did not receive the help they needed. When we asked them why, it wasn't just stigma. We thought it was going to be stigma. It was primarily availability of mental health services and affordability. So it was cost and availability. Unfortunately, mental health care is not covered by third-party payers in this part of the world. So people find themselves having to pay out of pocket. And also the availability is a problem. So when we talk about equity, it's important to advocate with third-party payers to cover these services. That's why we thought that prevention is key, and we got interested in school-based interventions, adapted some interventions. This is looking at improving emotional resilience in youth. This is one of our team members, researchers in one of the underprivileged schools delivering these interventions. This is myself giving, some sessions to the parents. But this is just to show you, interventions to local context can give you a wide reach, and looking at innovative, maybe digital electronic solutions could help address this treatment gap. In the last 1 minute, I'll talk about research, but also interested in looking at bibliometric analysis of mental health research in this part of the world, because if we want to talk mental health equity, service utilization, service delivery, it's also important to look at research coming out of this part of the world. You'll see we're also lagging behind, but improving. So here, for example, Turkey, it's at 87. articles per million inhabitants on mental health research compared to Australia, which was leading. We are, over the last 10 years, we've been steadily increasing in numbers of publications related to to mental health. But keep in mind that although 1%, although this part of the world constitutes of 9% of the global population, we contribute only 1% of mental health publications globally. But what has been very important for us, and this is my last slide, is collaboration. I think this is the importance of these kinds of webinar. This is a collaboration network looking at the 10 years of publications of mental health research. The size of the circle represents how many articles came out of this country. The thickness of the different lines is the degree of collaboration between this part of the world and the different countries. You'll see that this has been increasing over the last decade. You'll see that also when you look closely, when there is international collaboration, the citations for this kind of research increases. So researchers from this part of the world are interested in these kinds of collaboration. And you see the pattern where, for example, let's say, take Lebanon as an example. Here we have most collaboration with EU, but also with Australia. And so I think this is a reassuring trend, which hopefully will help foster innovation in research down the road. I think I'll stop here. Thank you.
Thank you. Thank you, Fedi, to give this overview on the Arab Mediterranean countries. And I agree with you. I mean, there is huge need, a huge gap in terms of research and innovation there. And the role of collaboration and networking, global networks is essential, and also transfer for results in technology and innovation. I think this is also what could drive, in fact, the progress and the convergence. So far, in many disciplines and many areas, there is not such a transfer. We have listened to many speakers on this brain health and all the experiences from California to the Arab Mediterranean, also in Europe, also in Argentina, and there are many initiatives that are already being developed. We heard from Steve, also from Tina, from Facundo, and from Fadi. I think all of this is allowing us to form an idea of where we're going with this framework. So one question before I give the floor also to other discussants that we invited today. Tina, you mentioned the private-public partnership on the ground. Also, Steve had mentioned it. Clearly, in our region, Mediterranean, this debate is not there yet. So I would like to ask one question. Who is really putting first the funding? The funding, Tina. So who is giving the money? So you, and the same question to Steve.
Yeah. So I think in the Danish case for the public-private partnership set up here, it has been highly important that the Ministry of Industry took the first initiative here. So it was the authority, the government, inviting for this setup of founding a public-private partnership, and they initiated the funding and signaled with that. They gave a lot of money to the funding. It's not enough. We need private funding as well. But the kickstarting the whole setup with public funding was key to this to the partnership.
That's a great question, Rim. I would say the same thing that Tina just said, and we're looking at California at committing funds and being the catalyst and organizer. And I think the reason for that is because the seat that's been missing at the table has been the public seat. When these systems fail, the public government is what picks up the costs, and the people suffer the most, and yet they're not at the table to in these public partnerships to make sense out of the economic equation. So they have to be the ones to initiate bringing these partnerships together and having a big seat at the table, because they're most incentivized to make these partnerships work.
Thank you, Steve. Paddy, how do you see the Arab Mediterranean region in that perspective?
As you said, I think I'm not aware of viable, successful private public partnership that are shaping up in this part of the world. But academics and academicians in the public sector as are coming together. I think, for example, at the American University of Beirut, we have the K2P Center, which is knowledge to policy. This is where academicians come together. They analyze the existing knowledge in a certain area. They try to translate the existing knowledge into a language that is understood by policy makers, and they communicate the translated message to a policymaker. This is the extent of the partnership that's taking place. There are definitely other smaller projects between, pharmaceutical companies and some academicians, but they're not at the level that I've heard about in this discussion today.
Thank you very much, Paddy. So I would like now to welcome other discussants to this panel discussion, starting with Marta Sanchez-Brett. She's the cluster director of the Cluster Salud Mental of Catalonia. I think Marta has been a pioneer in this development in Catalonia and in Spain. She has executive experience of different sectors, and she has been really much focused on the mental health cluster as a non-for-profit organization in Barcelona that works, in fact, to enhance the ecosystem in Catalonia for mental health, neuroscience, and aging, and well-being. Second discussant is Rina Talou. She is a professor of psychiatry and vice chair of community engagement, outreach, and advocacy in the UCSF Psychiatry and Behavioral Science. And also we have Luz Garcini. She is assistant professor of the Department of Psychological Science of the Rice University, and Dan Mannix, who is advisor and investor of Brain Capital, and also very much involved in the construction of the Brain Capital from an investment perspective. So you have heard the keynote speakers today. I would like to see them also on screen, so then we can interact, because they don't interact with me. They have to interact with the speakers, if possible. I am addressing my team, so if we can have also Tina, Paddy, and Steve on screen. Is it possible? Okay, until they do this, we can discuss a little bit what we have heard from Vicky. No, so she's telling me we can't. So if we want to interact, then we can go back to the speakers, which is fine. So I have a couple of questions, and I will give you the floor each one. So you heard from Steve, Tina, Paddy, and Facundo. So how do you see these developments, each one of them, each one of you from your own perspective, and how to, in fact, foster this brain capital framework via this via equitable mental health innovation. So I would like to start with Martha.
Okay, good afternoon. Thank you very much, RIM and the Brain Capital Alliance and EMEA to have invited me today to be here with such nice presentations. So as you said, we are mental health cluster. We are regionally based here in Catalonia, in Sant Boi del Llobregat. We act as an association, a non-profit association, fostering innovation to get competitiveness and employability for the market, for the ecosystem of mental health, neuroscience, and aging sectors. So based on our experience, and according to your question, what would you do to foster innovation? So we basically work through innovative projects that are funded on public and private basis, as said and discussed previously by the speakers. We think that's the best way to move forward and to develop products, to develop services, to work on social community services and assistance to really improve all the biopsychosocial factors around the user. So we work always on a user-centric manner, I would say. So where do we get the funding from? We work with European funds, we work with regional funds and national funds as well. But at the same time, we had always asked for private collaborations, and that's the best way to foster this innovation, to get everybody involved. Our projects are quite collaborative, so we mix transversally agents for the whole ecosystem, covering the policymakers, the users, the associations, the companies, and we try to move forward both gains for the user in terms of projects that can help on this biopsychosocial environment, the best for the patient, for the society, and as well for the economics, so that companies are really engaged on developing technology, on developing products, and they will as well increase this talent so that we can extend this equity that we have been talking the whole long of this session.
Thank you.
I don't know if I don't want to stand anymore so that the others can have their space as well.
Thank you, Martha. I think what you mentioned, I think it's essential also to put all these stakeholders together in a targeted objective. And this would also not only foster collaborations, but at the same time deal with, I would say, similar challenges together. This will, in fact, over time create the value needed. So, Marina?
Hi, everyone. A pleasure to be here, and thank you so much for the invitation from Rim and Harris and others to be a part of this. As was mentioned, I'm at UC San Francisco in the Department of Psychiatry and Behavioral Sciences, and we have multiple projects in the area of public psychiatry that I'm not going to go into detail today, but what I would love to do is to speak to some of the points that were raised today that align very closely with our some of our projects, particularly in the area of tequity. And I will mention too that I'm a clinical child psychologist and I'm a prevention scientist. So I very much resonated with so much of what was presented today to the speakers. But I want to bring in this concept of tequity that's definitely growing and is very much relevant to the brain capital framework. And so by tequity, what do we mean? Rhee et al. In 2021 defined it as the strategic deployment and development of technology to promote health equity, and has derived these 4 pillars that I would encourage us all to consider. I think some of these have already been raised in the talks today, but as we build this equity roadmap and framework for this initiative, the first is around data trust, so that data is collected with trust and representative of the population they are intended to serve. The second is around workforce diversity. Health and technology organizations and leadership reflect the diversity of the people they serve. Equity dashboards, highly relevant exactly to what the Brain Capital Initiative has developed and will be developing. But I would like to take us a step further, with the National Academy of Sciences and Engineering Medicine came out with a framework for equitable innovation in health and medicine, and really having us look at that framework and thinking most particularly about enhanced methods, metrics, and benchmarks that this initiative is really thinking about across each of the pillars around equity. And I know that this is part of the conversation, and one of the ways in which I think moving beyond community partnership to develop this data trust, the workforce diversity, the equity dashboards, and transparent AI is to engage in what we have been doing at UCSF, and other groups around the US have been doing, is engaging in what we call participatory co-design methods. And so really that is beyond partnership. It is really from the ground up, collaborating, co-designing. So beyond just collaborating, literally from the ground up, we've been spending, for example, a year with young people who've had living experience in the foster care system in the United States. They worked with us, with our tech developer, to build an app from the ground up that provides resources, mental health navigator services, and direct clinical services all within one app. They now own that app. They call themselves the Foster Space Advisory Board, and we're part of a national Biden challenge, actually, to develop a resilience tool for young people in the foster care system for mental health access and utilization. So I'm really excited to hear more about these community-based collaborations and engage in a conversation about really what does co-designing mean and how can we engage in that. Thanks.
Thank you, Marina. I think this is also essential if we are collaborating globally. So for design, it's essential, and to which level and how it works in practice, particularly in communities or in areas where there is very little public and private initiatives happening. This makes it a bit much more complex because there are takers. Luz.
Hi, thank you. And I'm going to build a little bit on what we've been talking about and what Dr. Toulouse-Shams mentioned. To give you a little bit of a background, I'm a clinical psychologist and epidemiologist, and in addition to the multiple hats I wear, I'm also a member at large of the board of directors for the American Psychological Association. And one of the things that we have done to push a lot of the awareness, right? Because we need to start by dismantling the systems of oppression and marginalization that have kept populations out of the science, right? About what we know about mental health, how to intervene, how do we even reach out to these communities to try to not impose our colonial views into what mental health is for them. So we have been working very closely with the White House, and a lot of the initiatives that you've seen put out through President Biden, for instance, to push for a mental health parity, right? If we do not talk of mental health at the same level of access to physical care, we're not going to make a dent in terms of changes for mental health. We also been pushing a lot for changing the way that the National Institutes of Health provide funding. We need more funding for research. We need to know, what the community is about. How do we go about conducting community engaged science in a way that is equitable, inclusive, that we not only adapting interventions that we have that were not initially developed for diverse communities, but how do we start co-creating knowledge together to move the needle forward? We need a workforce. We don't have the workforce right now to be able to satisfy the needs across multi-domains. So how do we embed mental health providers and people with this expertise across all the places where people live, work, learn, play, heal, because we know that we need to do these interventions across several settings. And in terms of technology, I think I'm going to put a cautionary note, because it's important that we use it in a very wise manner so that it doesn't contribute to create and widen the existing gaps. Because we know that there's many communities who not only don't have access, but do not trust the use of technology, because we know that in the past, it has backfired. And what are some of those things that we need to be aware when we're talking about technology? For instance, we know that it creates other problems, such as, it start cutting on the social skills of people. So how do we make sure that we're using technology to our advantage that will not backfire? And the last one that I want to say, I love the fact that we were talking about entrepreneurial therapy, but I would like to say that a key component of that is not so much teaching people skills, because people have skills, particularly from marginalized communities. It's about how to teach them to protect themselves and to stand up to the systems of marginalization that keep them oppressed and that harm their mental health.
Thank you very much, Luz. I think these are all key aspects that we need to take into consideration in the construction of the brain capital framework. You mentioned where the money is coming from. I think funding research, particularly in neuroscience, and connecting this to the real economy, labor market is also essential. And I turn to Dan. So Dan has years of experience of raising capital. So, Dan, what is your view on this, and based on what we heard from Steve, Tina, Fadi, and Facundo?
Yeah, hi, Ren, and thank you for having me today. I come from a slightly different perspective. My career has been in asset management, so managing money for large pension funds and sovereign wealth funds and foundations. And the last year has been spent really investigating the connection between those owners of capital and the brain health space, given all the explanations on this call about its imperative. I won't spend more time on that, but I think my observation is that the structure and framework of public-private partnerships will inevitably differ depending on which country and even which state one is looking at, and that depends on the motivations of the people in power. But it does seem to me that this can't be a purely state-driven activity. It needs to be something that harnesses the interests that the private sector has. And I think we are at quite a unique moment in time. You'll all be familiar with the letters ESG. And I think that our ability as asset managers and advisors to pension funds to really have impact in the social space is relatively limited. And yes, I think there is a moment in time where the principles of the assets, so I guess the wealthy people and the people responsible for pension funds are as motivated as they've ever been in relation to the brain health space, and that's through personal connectivity to it. And what I find extremely exciting about the brain capital concept is that it transforms what we've been talking about as mental health and mental illness into a socioeconomic concept that should be highly motivating for those who don't have such a personal connection with it, because the numbers are equivalently large to other social imperatives we have at the moment, and the current trajectory is really unaffordable. When one combines that with the scientific progress that we're making in understanding the brain and that we will make over the next decade, it forms a extremely exciting catalyst to bring those parties together. And so I'm excited to be involved in any organizations that are looking to bring action from asset owners into really high efficacy solutions. And I've been particularly spending time with California through Steve's work, and it's very exciting to see their commitment to it and the commitment of asset owners in California, which hopefully provides a template. In relation to equality, for me, the two things that I land on is that it's imperative that we use the scientific understanding we're going to gather to increase the efficacy rates of the money that we spend, because at the moment, so much of what we do just doesn't have a high return on investment, if you like, or a high efficacy rate. But the science should really help us improve that. The second thing is that we need to use technology to work out how to deploy the solutions and treatments that we come up with at scale, because if we can deploy them for a very low marginal cost, we can leverage the work that's done in the wealthier nations to be deployed in the less wealthy nations. And obviously we all know the analogies to internet banking and mobile phones in Africa, and that kind of technology is something that hopefully we can deploy through mental health. And so I think there's lots of reasons to be optimistic. I think that the asset owners are not yet engaged in this topic, probably partly because they don't yet understand that we are actually moving to a world where the money we spend is going to have a much better payback. But I think over the next 2 to 3 years, that's going to significantly change. And hopefully the public and private sectors are going to work together to really have an impact in the space.
Thank you, Dan, for bringing in the asset owners. I think this is a very important discussion going forward, and probably our next webinar should focus on this, the role of asset owners in building brain capital globally. And this also probably even give an answer to where I would say the deadlock, the ESG debate at the same time. So this can be really a nice way or proactive dynamic for asset managers and any other players in the financial market to be proactive in building an economy that is conducive to brain health and higher brain skills and higher brain capital. So thank you for bringing this up. I would like to go back to Steve, Tina, and Fadi. And thank you very much, Dan, Luz, Marina, and Marta, for your comments. And I would like to ask Steve, Tina, and Fadi to have just 1 minute and how you see the future of equitable mental health innovation, and how do you see it really fostering this brain capital framework? Each one, 1 minute, because we need to close the webinar. Steve?
Okay, you put me on the spot there. Brain health, I think the problem is a very complex one in which the world is very siloed. The power of the brain capital framework is precisely that. It creates a framework that integrates everything, and we see how all the pieces are connected. We have the ability to begin to track and measure and calculate returns on investments. We have the ability to understand new technologies and where they can harm and where they can help. And we can understand the economics and bring public and private partnerships together. So I think it's a really an integrated fabric that is the reason why we need to stand it up and embrace it. Thank you.
Thank you, Steve. Tina?
Yeah, I can only echo what Steve already said as well. I think what we've heard throughout the last couple of hours is that the mental health challenge is huge, but I also think we've heard examples and also input on that there is a way forward, and there is an interest in finding a way forward. And I think that's what we need to unite around and then pursue the best way we can. So it's a mountain we have in front of us, but I'm hopeful for the future.
Thank you. Fadi?
So really, for me as a clinician and a researcher, the ultimate goal is to increase access to care for those who are in need and to improve our prevention efforts. So less people would need us to intervene. And for this, obviously, collaboration is needed, funding is needed. It's great that we're having this discussion today because it gives us this multi-sectorial perspective to brain health and mental health. But as we think about digital innovations, it's important to keep in mind what one colleague mentioned, I think Dr. Garcini, about the feasibility of these innovations in different parts of the world. For example, when we were implementing our resilience building interventions in schools, it was using worksheets and workbooks, etc. COVID hit. And when COVID hit, we wanted to switch it to an online intervention, which we did all the work. And then once it was ready, we found out that, a good number of our participants did not have access to internet, and some of them did not have devices. So really, when we think about innovation, it's important to consider the feasibility of the implementation of these innovations in different parts of the world. And thank you for this forum.
Thank you, Fadi. So
Rem, if I could just add to that point, I think that the artificial intelligence is going to drive this mental health pandemic to an ever higher level. So it's a great example where technology is at its worst. But I also think that the artificial intelligence, which is very pervasive, can be offset by understanding the real intelligence of the brain and understanding how to offset those impacts. So technology cuts both ways.
Absolutely.
yeah, thank you for bringing up the artificial intelligence, which in fact is key. I mean, because otherwise the artificial intelligence will overtake our natural intelligence. And this is what we don't want. But just to conclude, I mean, this webinar has addressed a very key issue, which is the equity in mental health innovation. The generally innovation, any innovative activity or action is practically taken forward by a certain segment of the population. That's key for our brain capital, and is maintaining our brain capital and enhancing it, is to consider that equity in mental health innovation is not just an act to help or an act to share. It's not an act of compassion. It's really an investment. It's an investment for the very foundation of our society and our brain capital in society at the global level. Where in fact both brain health and brain skills, they go together, not only about disease, it's also about the optimal functioning of our brain for the sake of the society and for the sake of the economy. So then we can have a much brighter future for future generations. So I think we need to take this as an investment. Every investment, everyone has to invest, not only the private sector, but also the public sector and every individual in this. And of course, we can see that the level of preparedness is not the same. There are asymmetries. And this is why a global network, global collaboration is essential. So I thank you very, very much for sharing this almost 1 hour and 45 minutes with us from different parts of the world. Steve here in Barcelona, so we can continue the discussion with Dan. Tina, thank you for joining us. Fadi from Beirut, hope everything goes well over there. Facundo from Argentina. Harris from San Francisco, and hope everything goes well with the induction. Marta from Barcelona. Luz and the rest from the US and down here in Barcelona. So thank you all, and I thank all the team for organizing all this event, and we keep working together, as mentioned by Marina, on co-design, co-creation. So thank you all, and I hope to see you soon in other events. Thank you. And let me just say that this webinar is recorded and will be broadcasted in our social networks and YouTube. Thank you very much.
Gracias.